Good. Allow me to introduce myself. I am Natasha. I'm a registered nurse, CEO of iCareRN, which is a care management company. I started my business about 2 years ago, and I have grown in that space and now collaborate with other companies that are in the same space. And I would like you to just introduce yourself and tell me a bit of your background and how you got into the health tech space.
Yeah, I didn't come by it the traditional way. I'm actually have a degree in engineering and computer sciences. And so I went the technology route before I went to healthcare. And it was only when I had a couple of situations with family members. First, my daughter, who was born, spoiler alert, she's okay now, but when she was first born, she had difficulty from a respiratory standpoint. And we had to go back and forth about the first couple of months after she was born to the doctor. And that's when I was exposed for the first time, really for the first time, of the healthcare system and the complexities. And I said, you know what? There has to be a better way. And so I got exposed that way from family, for first my daughter, and then later on, my dad, who suffers from congestive heart failure, dealing with doctors, helping him manage his process, understanding the behavioral changes that he needs to go through to manage his diet or exercise, really opened my eyes. And that was the opportunity for me to say, there needs to be a better way. And that's how I went down the path of telehealth and eventually care management and rural patient monitoring type programs. That's how I built. And from there, my co-founder, we built out our company, SynsorMed, to help providers, nurse practitioners, to guide them in helping their patients and with technology and services to help them guide them through this process. And so that's how I started. I'm not a doctor or a clinician, but I see the hard work that you and your team, as well as your members here on this channel, all the work you guys go through. And so I'm just an admirer of that. And hopefully in some small way, we try to build something that makes sense for you guys as you guys are looking to scale in this new area.
Mhm. So very much like myself, I started because family members with chronic health conditions, as well as myself, I have several chronic health conditions. And I felt as a nurse, I needed to have more of an impact on my community. And so chronic care management was that route for me. I'd like to discuss the role of nurses in RPM and care management, where they fit in, and the value nurses bringing to the space of RPM care management.
Oh yeah, absolutely. And I was thinking about this and preparing for this conversation. I just realized that nurses are uniquely positioned to take advantage of this opportunity. One of the things we do work with nurses on our staff, and we have nurses who reach out to patients on our behalf. But things like wellness calls, right? The care that you guys go into, the preparation that goes into doing that is so key. The new things around motivational interviewing, right? Understanding how to motivate patients to better behaviors is also a key opportunity for nurses to be involved in that. Care plans, those are things that have been around forever, but definitely something that's taken the forefront when you're looking at personalized health plans, understand patients' exercise goals, understand their motivations. Those are some of the key areas, as well as escalation. So if there's any issues with patients that are either being monitored or need help, how do you have an escalation path? And so you think about those are some base level things that nurses do, but all that is so important because technology is only as powerful as the people behind it. And then if you have nurses that can manage that process, already have your workflows embedded, technology is great as a partner, but it can't lead. People always want to think the technology is the one that makes things happen. No, it's the people behind the technology that make it successful. So if you're a nurse or and working with healthcare organizations, your skill set is going to be vital, especially in this new area of the AI that's coming, artificial intelligence. And we maybe we'll discuss that later, but this is going to be a skill set that you can leverage and get to the next level in your career, but ultimately to help patients more in that scale.
Mhm. So one of the things I've found is a lot of nurses, they are afraid of technology. We use a lot of different EMRs in whatever setting. We have to learn that, but there's still this fear of, I'm not good with tech. So what advice or what would you say to those nurses that they see RPM and they're like, that might be too much for me because it's too techy. What would you say to those nurses that they want to do something in tech, but they're afraid it's too much?
We work with nurses all the time. And that's where we talk about, that's what this training is discussing a little bit about understanding the right partner, right? I think you went to school to be a nurse, not to be tech staff, right? And so you want to find that right partner that can help guide you in that process. And just in clinical workflows, ways to manage all the complexities of managing a person's healthcare, there's workflows in technology. And so if you have effective workflows that work, for instance, if you're working with a technology partner that has cellular devices, that makes it easier for patients because they're not fumbling trying to connect it to a Wi-Fi or to a Bluetooth. And patients are not getting frustrated. They just want to be able to use the device, get the reading and make sure they're healthy and move on. And so having a workflow that kind of incorporates that to understand one big thing in technology is about user testing, making sure it's simple for the user to understand how to use it if they didn't even have instructions. And so that's the way you want to partner with a technology company that understands and cares about the patient at such a level. So the patient, who in this case, a lot of patients we work with tend to be older. They do not have to read a lot of instructions. They can just use it and move on. And then if they do run into issues, you don't want them to the patients call you about technology. That's not your expertise. So you want to have a partner that has the support staff in place that can talk to patients in a calm manner, communicate clearly so that patients can get on with their day and making sure they feel heard and seen as they're taking care of the condition. So I say when we talk to nurses, the goal is absolutely to work with the right partner and having partners that understand the patient journey and making sure that they deliver something that's easy for everyone to use and can help you bridge the gap between technology and clinician.